Hi, everyone. Welcome back. Today, we're joined by Dr. Adam Hirsch, Professor of Pediatric Infectious Disease at the University of Utah, and Dr. Emily Thoreau, Associate Professor of Pediatrics Infectious Disease, also at the University of Utah, and the Associate Hospital Epidemiologist at Primary Children's, to talk a little bit more about children and COVID-19. This is a part 2 follow-up from our conversation a few weeks ago with the two of them. Emily and Adam, thank you so much again for joining us. So I want to talk about what's happened in the last 2 weeks. So some school districts around the country have started to open back up. Things are starting to move a little bit. Is there anything that we've learned from this first round of students headed back to school? There's been a lot of attention on a recent increase of children getting COVID. And do you think that might be because schools have opened up? Adam, we'll start with you on that one.
Sure. So I'll just actually respond to those questions maybe in the opposite order. There is definitely an ongoing trend of more and more cases in children and in adolescents. So and that's just in terms of their sheer number, but it's also interesting to look at the percentage of all cases that are accounted for by children. That's also going up. Early in the pandemic, children accounted for something like 1% to 2% of cases. And that has steadily increased. And depending on where you look, in what part of the country, or whether you're looking at the US as a whole, we're starting to get close to the double digits. Children still represent the vast minority of COVID-19 cases overall, but the share of total cases is going up. Why is that? The most likely explanation is because children are gradually coming out of sheltered experiences, and for the first part of the pandemic, children were really protected in their homes mostly, and really limited. Not only could they not go to school, but they were really limited in their activities. And then as we got into the summertime, children were distributing themselves more frequently in all facets of life, including sometimes summer school in terms of just going out and doing usual activities, camps, and we've all heard about some of the challenges that some camps experience. So almost certainly the explanation for the larger share, with the larger number of and the larger share of cases among children, is due to just more and more circulation in the community. Schools have begun to open nationwide here and there, and we have certainly heard about some challenges that have happened in schools in terms of children showing signs of illness that turns out to be COVID, and having exposed their close contacts, and having large numbers of quarantine, etc. I think there is a narrative out there right now that some schools have opened and that it's universally gone poorly. I think we have to just be careful about jumping to that conclusion. It can go poorly, but all that we hear about in media reports will be circumstances where it didn't go well, where there were a case or two, or a school that didn't really have a good reopening plan to implement good mitigation strategies or a contact tracing plan. What we really don't have a sense of, and we don't hear reports about, are the schools that have reopened with really careful reopening plans, where things are so far so good. And that is still a sort of to be determined. But I think, sort of in summary, children can get COVID-19 and they can transmit it. And we're seeing evidence of that as children are circulating more and more. And this does have implications for school reopening.
As far as that age category goes too, with the word children, has there been a specific age group in that under 18 that has been the most affected? Do we have any information around ages with that? Or are we still learning about the specific age categories for it?
You want me to answer that one? So we do know a lot about the age groups of the children at this point, but we're still learning as well. As Adam pointed out, the majority of the patients that we've seen with COVID are still in that adult age group. When you break out the pediatric age group, we are seeing more in the adolescent sort of age groups, more positive, probably mostly because of their likelihood to be interacting with one another more than the smaller kids are. And so I think as far as whether somebody's more likely to get it, we still don't know. There was one study that did an age cutoff of about 10, saying that kids over 10 were a little more likely to become ill with COVID than those under 10. But it was, one study in with South Korea, I think, Adam. But anyway, I think we're still going to be getting a lot more data as far as that is concerned, especially as we open up schools.
And I want to point out something too that Adam brought up about the media portraying things specifically for if something did not work well. I think it's important too, as we learn more, and specifically in Utah, to kind of keep an eye on what happens here. Do you guys have plans, or is there some sort of plan to kind of track what happens in the Utah school system and kind of figure out how we can adjust based off of that? Adam, I'll have you answer that one.
Yeah, and I do just want to comment that my comment about media portrayal is not a criticism of media. It's hard to get information and write stories about schools that reopened and haven't had COVID cases. That's just not a story. But it will be a story eventually, because sort of to your question, we and colleagues throughout the state, and actually colleagues throughout the country, are very interested in kind of pooling our knowledge and pooling our experiences to learn about how this all goes. Because a lot of us feel, those of us in the infectious disease field, those of us in public health, we have serious concerns about school reopening when it's not done with really good safety measures in place and mitigation strategies. And there's reasons to be concerned that opening schools in that context, and especially in the context of community transmission rates that are really high, there's a lot of reasons to be concerned that opening schools without appropriate mitigation strategies could contribute to lots of cases among the school children and spill over into the community. On the other hand, a lot of us have, trying to look at this as a glass half full, a lot of us have optimism that when schools are open with all of the safety and mitigation plans in place, and sometimes that requires not to be in session for every student every day, but in many cases that's going to require, in order to maintain adequate distances in classroom, but in many cases that would involve a strategy that's being referred to as hybrid, where your student might attend school a couple of days a week, and other students would attend school on the other days of the week in order to limit the class sizes and to maintain more space in the classroom. A lot of us are optimistic that when school reopening strategies account for maintaining distance, require face masks at all times in every person, use cohorts to the extent possible, encourage hand washing, and that when those school reopenings occur in the context of low community transmission rates already, that things can go well. Again, I think some of the things that we've heard about in the media that are just really important to highlight, that are important mistakes. So, for instance, there was a student that attended school while this student was in the early stages of an illness, and this student also had a test for COVID pending. It was performed, I believe, the day before school started, and the student attended school the next day. These are challenges, and you can't screen every student literally at the door and ask every single question that you might want to ask about their health status. But these are the kinds of things that can contribute to problems. This student attended school, got sick, was required to leave school, but in the interim, the student was attending school in an environment where aggressive mitigation strategies were not in place. And as a result, there were lots and lots of exposures, and there was a large number of students that had to be quarantined. That's a great example of how this can go very poorly. But I think, and I hope, that we will be able to collect lots of examples of how schools can reopen in a safe and successful manner. And I'd love to see that story come down the pike in all sorts of media outlets.
And I think we have seen a little bit of that over the summer. We have had a few summer programs and a lot of daycares that have been open. And I know we have a little bit of a bigger challenge with the bigger kids, but I think that we can use some of that data, and that's what we've used to base a lot of our safety mitigation processes on, our experiences that we've had already, and a lot of the success stories.
And I want to just add one comment to that, Emily, which is to say that there will, no matter how well and how sort of by the book school reopening plans are. There will be cases among school children. It's inevitable. And I just think we have to be careful in thinking about how we define success versus failure. Success can include experiences where small numbers of schools do experience, students who acquire COVID-19 from their community, but who are subsequently identified, and isolated and appropriate quarantine is put in place. We can't define success as no COVID ever, because if that is the goal and if that's the definition of success, then there's no way to reopen schools until this pandemic is behind us.
I want to talk about quarantine too from a school perspective. The process or the guidelines on quarantine for school in Utah specifically changed last week. The governor released new guidelines on what that modified quarantine means. I want to talk about what the new guidelines are, and within that, how do these schools make those decisions, and who is considered a close contact if you actually test positive? Adam, we'll start with you, and then I'll go to you, Emily.
Yeah, I think it's a great example of how things have gone with this pandemic and how they need to continue to go. And I think this is actually a great example of our community of public health leaders and school leaders working together collaboratively and adapting and improving things as we go. So there was an original definition and sort of strategy around quarantine after a student tests positive in a classroom, which has now been abandoned, but which basically allowed students to return to school essentially no matter what, but they would otherwise be quarantined at home. This was not felt to be consistent with standard and traditional quarantine strategies and policies, and which was something with which I agree. And through a lot of collaborative input from school leadership, government leadership, and public health leaders, this was modified to be essentially right in line with all quarantine definitions, and it's this concept of close contact. So close contact is defined as being within 6 feet of someone for longer than 15 minutes or longer without a mask on. And that definition is what's being applied for school classmates. So if a student is closer than 6 feet to a classmate who tests positive, that student is in this quarantine bubble and would be considered a close contact. And this, as it stands now, this definition does not, if you're within 6 feet for longer than 15 minutes, even if you and the classmate are wearing a mask, you would still be considered a close contact. That's the current definition. Operationally, this could, if and when a student tests positive in a classroom, this will lead to a small number of students in most classrooms meeting the definition of close contact and requiring quarantine, but not the entire classroom. And basically, it comes down to the number of students in the classroom and the classroom size. The more distancing there is in the classroom, the fewer students there are in the classroom, the fewer students that would be vulnerable to quarantine. And it's one of the factors that favors some of these hybrid approaches to school reopening, which reduces the number of students in the building, in the classrooms at any one given time, such that the number of students that are vulnerable to quarantine, should a student test positive, is reduced to as few as possible.
And
Emily, is there anything you'd like to add with that as well?
Yeah, I think everything that Adam said is completely correct. And I think that when we're thinking about why we're doing these strategies in the schools, it's really because if we get an infection in the classroom, we want to quarantine as few people as possible. And just another little, the definition between quarantine and isolation, I think a lot of times people get that confused. So isolation is what you do to yourself when you are positive. So you isolate yourself from others. And the quarantine just means if you've been exposed. So you're not sick yourself, you're exposed, and you wait out that 14 days and what you do during that time. So the previous definition said that maybe you could go to school because you were considered an essential worker, which is how the state had sort of defined things. But I think the new definition makes a lot more sense, and I think it'll protect our classes better than the old definition.
I want to talk a little bit too about something that a teacher brought up to us during our last Facebook Live. A teacher asked us if I take my class outside, can we have a mask break? Can we all take off our masks, spread out, and just take a 5-10 minute little break to get some fresh air and not have a mask on? Is that something that's okay? And if so, how do you go about doing that? Emily, let's start with you.
Sure. I think that you need to think about all of these things in terms of, if somebody is sick, how many other people are going to be affected by a quarantine, right? So if you're outside without a mask and everybody's more than 6 feet away, I don't think that that would be considered a high-risk exposure where you would all be quarantined. So if you can ensure that everyone's going to be 6 feet away, then I think that that's a reasonable risk to take. Now, being outside, again, is another layer of protection. And so is 6 feet the right distance outside as well? We don't really know. I think we're all going with that at this juncture just because we don't have enough data to say one way or the other. I think you probably need to be careful about, kids on a playground. Are they going to get in each other's face and that sort of thing? And those are the times when maybe you might need to consider masking outside. But I think if you can ensure that, everybody's sitting down eating lunch 6 feet apart, it's probably a very minimal risk outside.
Another thing that has been brought up a couple of times is making that decision between sending your child back to school and having them do online learning from home. And this is obviously a very personal choice. It depends on a lot of different circumstances. But I wanted to ask the two of you just for your opinions on choices. I know you're both have school-age children, and you might have made a choice one way or the other. And I want to talk about maybe what questions you considered and what other parents should consider when they go to make that choice, whatever it may be. And I want to preface that whatever a parent decided to do, we have no room to judge them. They might have made a decision to send their kids back to school because it was something that their family had to do. But I think it's important for parents to be able to weigh pros and cons of both of those things. Adam, let's start with you on that one.
Yeah. So I think this is absolutely an individualized decision, and there's absolutely not a right answer for everyone. I think, fortunately, the recent epidemiologic trends in Salt Lake County and in other counties throughout Utah these trends are favorable. And so first and foremost, the considerations that I think everyone needs to make about deciding, the school districts are making decisions, but as parents, there may be circumstances where you're not comfortable with the decision that the school district made, whether that's to not open schools or whether that is to open schools in some fashion. But once there's a decision point to be made, so for example, if your school is offering some portion of in-person learning, I think the first question that a parent or caregivers need to ask is, what are the trends in my community? How much of a burden is this disease right now in my community? And this varies quite substantially throughout our state. There are counties where there's 2 to 3 times more transmission than other counties. So that's kind of the first starting point is, are we and there are guide points and gating criteria that have been proposed and that are being used and that are being looked at by our state leaders, by our school district leaders to guide these plans. And many of the plans that have been made have considered and have been guided quite a bit by the epidemiologic trends in the community. So that's, I think, the first thing. And we could talk separately about the specifics there, but I think we need to have an understanding of, are we in a higher transmission environment or a moderate transmission environment, or one of the counties with much lower transmission? The next thing that I think parents want to look through and think about is, what is the school offering specifically? And to the extent that there's concerns about risks of acquiring this infection for the child and bringing it home to the family, I think there are definitely differences in, for instance, the hybrid approach versus an approach that has all the students there all the time. So I think parents would want to ask, what is the classroom size going to be? And how far apart are students going to be during a traditional classroom day in a traditional classroom? Are they going to be kind of the same as it was before, maybe 2 or 3 feet apart at times, or are they going to be more? Almost no classroom is going to be able to achieve 6 feet of distance for every single student. But for many students, it may be that you're only 3 or 4 feet away from 1 or 2 students. So I'd want to have sort of a visual of, how many people is my child going to be close to? I'd want to have a sense of how, and this is maybe a little bit harder for parents and caregivers to ascertain, but to the extent possible, I want to have a sense of how committed is my school and my school community to the mitigation strategies. I mean, is this a community and environment where I feel like they're going to be really enforcing, for instance, masks for all students all the time? Teachers are really committed to this. School leadership is really committed to this. Or is this an area where there's some controversy, and in the school community there's not really as much universal buy-in on that? That might be something that would make someone consider not bringing their child to school if that was a major concern in their household. And then lastly, and unfortunately, I think, of course, one has to look at the experience of their own child. And unfortunately, we all had the experience of home or remote, or whatever version of remote it turned out to be, and kind of how that went. And I think for most students, it was not as effective a way of learning, and certainly not as enjoyable socially for most students, and therefore something that involves an in-person opportunity would be preferred over remote. I will say, however, that there is a fraction of students, I don't really know the percentage, but there is a significant number of students for whom remote learning may have actually been a better learning opportunity and a learning environment for those students. If the caregivers can facilitate that, and if that's a better space and a better method of learning for the child. They didn't ask for that approach, but they had the opportunity to experience it. And in some cases, parents may choose to continue with remote learning because they learned that, hey, this actually worked pretty well for my child and for our family. So those are sort of collectively my thoughts to this. I will say that in my own family, I have 2 school-age children. We have the opportunity for a hybrid type of educational model, and we've chosen to participate in that for both of my children. It's not every day, but it's a limited number of days each week.
Emily, is there anything you'd like to add to how you've approached this as a parent?
Yeah, I agree with Adam. I think it's a very personal decision for everyone. And there's actually a nice handout we've put together at Intermountain Healthcare. It's a Let's Talk About School Reopening. And it kind of helps you through sort of a risk stratification. So we could make that available for people. I don't think it's proprietary in any way. It's meant to be useful for people to make this very decision. But it goes through a lot of the things that we've talked about here today. And you have to really think about, who is at your house and how at risk are they? How is your school handling these mitigation strategies, and how well are they able to adhere to them, and your community as well, your school community. I think that's all very important. I will say that in my community, I also have 2 children. One's in daycare and the other one is in school age, both younger. And so we are choosing to send them both back. It's a 4-day-a-week model. So they will be in school 4 days a week. But we all know that, with this is everyone's all in. And hopefully if we have problems, then we're going to need to reassess the strategy. And I feel comfortable that the administration of the school will readdress the strategy if we start to have problems.
So with children going back to school, say you are sending them back like you both are, is there something that you can do as a parent before your child goes back, or like physically steps into the halls of school, and when they come home, to help mitigate the potential spread of the virus? Should you be cleaning off their clothes, having them wash their hands? What are some good tactics that you can kind of start getting them in the routine of doing? Emily, we'll start with you.
I think really important, especially for the younger kids, if they have not been wearing masks because they've not been out of the house, that, practicing that before you go to school is of utmost importance, because you can't expect the teachers to really be able to handle that. Some kids may do just fine, but especially if you have a kid, I know my 3-year-old we've had to practice a lot, whereas my 6-year-old is fine. So I think if depending on your own household, practicing that before you show up on the first day of school is important. The other things, I think a good rule of thumb, when all this started, we were thinking, do we need to wash our groceries? Do we need to do that? I think what we've really learned is that exposure to people is much more at risk than exposure to things. And so I know some ED providers that are taking care of COVID patients all day come home and take off their scrubs and go right to the shower. I'm not sure that's really necessary. As far as the data goes, we haven't seen a lot of transmission or any that I know of from stuff. And so I think hand hygiene is really important. And so washing your hands. Masks, on the other hand, they're going to probably get a little grimy. And so I probably would recommend a clean one every day if you can do that. And we've also recommended in my community, have an extra one just in case you get a malfunction or it gets wet or something like that. So have an extra one at school too.
And Adam, what about you?
Well, I think, Emily, just reiterating, I think masks, that's, that is the most important mitigation strategy, I think, and being comfortable wearing masks, for a long time. It's a long time, a school day, to keep a mask on. There will be moments when, you have to kind of, scratch an itch or take a break from it if it's outside, and hopefully those opportunities will help. But I think what we have observed is that for most children of all ages, they get the hang of it. The other thing that I would mention just in terms of preparing for coming back to school is a little bit less about transmission, but just more kind of the emotional side of it. I think for a lot of students that are going back to school in some fashion in person, it could be quite a jolt. In some cases, some children may not have really been around larger numbers of people for a long time. The abrupt end of the school year, I think, was a jolt for a lot of students, and we hear things like students haven't actually seen even the outside of their school, which was maybe the most important, short of their home. Other than their home, maybe one of the most important places in their life. So I think that it's worth thinking about the beginning of the school year as being potentially a pretty emotional time for a lot of students and their family members and their caregivers, and just kind of anticipating that. I think that the routines are going to be different, and just talking to children about the fact that through all this, flexibility and adaptability is going to be key. The school day and the school environment is going to look a little bit different, and we may have to give up some of the routines and some of the fun things that we normally get to do in school environments. But again, kind of expecting that, and focusing on the good things that we will be able to do, hopefully, kind of offsetting any of the losses that we have there.
Along those same lines too, what are some sort of things that the schools should or will do or will be looking at in terms of how cases are spreading in the community to help guide those decisions about staying open? We obviously want the schools to stay open. So what are schools and you guys looking at to make sure that we're moving in that right direction to keep the school going through the winter? Adam, we'll start with you.
Yeah, so I think, the horse is out of the barn for most school districts, in the sense that the decisions have been made about if and how they're going to open for in-person learning and in what format, whether it's every day of the week or 4 days of the week or 2 days a week or not at all. So I think regardless of how those decisions are made, the next set of decisions that are going to be made are going to be about continuing or continuing what the current plan is, or changing. And by changing, I mean maybe going from remote to some version of a hybrid or in person. Maybe changing could mean going from an all in person to a hybrid model, or a hybrid model back to remote. And so the kinds of things that schools and we are collectively going to be looking at are changes in the epidemiologic trends in the community in terms of case numbers, incidence of cases in population as a whole, and then especially among school-age children in the surrounding communities within the county, statewide, and then also within the county. And those are aggregate numbers that we all see, sometimes on a daily basis. But it's also going to be important to track what's going on frankly in the individual school community. When you start to see, if you start to see a couple of students testing positive, that's going to have an impact on what happens to the classroom or what happens to the entirety of the school. So there's a lot of, thanks to a lot of hard work from folks in our health department, we actually have very granular, very timely, and very actionable data regularly available to us. And these data are going to be, they've been really, really important so far, and they're going to be even more important now that we're introducing a whole other dimension to our society, which is opening schools.
Two more questions for you guys. Emily, this one is for you. Are parents putting teachers at risk by sending their children back to school? And should we be wearing masks all of the time? There was a question that was brought up around, well, if I don't live with these people and I wear a mask when I'm at a grocery store, should I be wearing a mask when I go to visit my cousins or something like that? Do you have any thoughts on that?
Well, certainly, just as the decision for a student to go return to school is very personal, the decision for a teacher to return to the classroom is just as personal. And, a lot of teachers are making those very hard decisions as to whether they feel comfortable enough doing that. Is the school and the plan going to protect them enough where they feel comfortable doing that? And I think there's been a lot of hard work gone into this process. And, for some teachers, maybe the answer is no, but for the majority of teachers, at least what I've heard, the answer is yes, they will be returning. And I haven't heard so far that we've had a lot of student to teacher transmission. Just like in the healthcare setting, I think what we do know is the biggest risk to teachers is the same as the risk to healthcare providers. We really haven't had much patient to healthcare provider transmission at all. And in fact, the transmissions that we've had in our institutions have been provider to provider when they let their guard down. They're in the break room, they have their mask off, and they're eating lunch with their friend. And that's when we see the transmissions. And so I think, from a teacher perspective, it's probably going to be similar. I think they need to be very careful when they're in the teacher's lounge and they're taking a break and they're having their lunch, or whenever they get their breaks. I think being very careful around the other adults is going to be very important. And so I think it's going to be a very personal decision for all of them. And hopefully we're doing as much as we can to protect them. And then your second question, I'm sorry, Amanda.
You're good. It was around if I should be wearing a mask around people that I don't live with.
So I think, again, the answer is masks are probably never wrong in this day and age. So I think that if you're around a new group of people, it's a reasonable thing to do. Say you're in a grocery store, even if you're outside and you think you might be interacting with people closer than 6 feet, I think it's reasonable. And then even, discussing maybe even in your own household, you can assess your own risk there. Maybe not in the people that you live with all the time every day, but if you are with, going to visit an elderly grandparent or something like that, then maybe you ought to consider that too, especially if you're going to be indoors. And that's going to become more and more of an issue as the weather gets colder.
Yes, it does snow here, so that'll be interesting. Adam, last question for you. What are some bright spots on the horizon for keeping school open? What is going well with COVID-19 and what we've been learning?
Well, that's a hard question. I think that locally, some things that are going well. I think there's more and more sort of normalcy to wearing masks. And we know masks are, for right now, it's our vaccine. It's not the vaccine we want, but it's the vaccine that we have, and it has modest to moderate to even more than moderate effectiveness in preventing transmission of this virus. So I think there are data to support this, but I think you just look around in our communities, more and more people are wearing masks, are comfortable wearing it. You see children wearing masks, again, thinking about school reentry. So I think that is something that is going well. And along with it, there does seem to be more and more convincing evidence that the disease transmission rates are likely starting to decline. That story is still to be finalized, but there are multiple data points that seem to be pointing in that direction. There's another area of optimism, in my view. I mean, again, there's progress being made in therapeutics, greater availability of the antiviral drug that we have available, promising availability in regards to other forms of treatment, including monoclonal antibodies. The news that we continue to get about vaccines is generally quite promising. It's also important and exciting to know that there's multiple candidates being studied simultaneously, and maybe all of them will be successful, but we're hopeful that maybe more than one will be successful, which would enhance availability. And then lastly, I think we do see promising news about the possibility of greater availability of rapid tests. And so more testing is a good thing, more testing capacity and more testing availability. I think we're starting to learn that there are strategies when tests are available to do surveillance in large group populations, such as among school children. And with greater test capacity and availability, especially with some of the newer options that we'll have that will provide the opportunity to have faster turnaround time, we may be able to do better surveillance of disease transmission, which could be a really helpful tool in opening schools and keeping schools open.
Emily, is there any last words that you'd like to have or include for this as well?
Yeah, I think on the bright side, there also might be some different swab techniques or saliva techniques. So I know a lot of people don't want to go get that test because they hear it's so terrible when they do the nasopharyngeal swab. And so there are some things on the horizon where maybe, we could do an anterior nares or a throat swab or a combination of the two, or you might be able to test your saliva or something like that, or something self-collected. So those are things that are all on the horizon, not quite prime time yet, but I think those are promising as well. And the testing availability, I think, is going to be huge. We've utilized testing availability very successfully here in our long-term care facilities, where they've kind of gone in and just tested everybody. And it's kept a lot of our long-term care patients who are the most high risk safe in our state. And so we may be able to do something like that when we have better testing availability and an easier testing availability with our schools as well. So we'll see. I think there's a lot of things to have some hope about. And we're all just really hoping that opening of schools goes well. We know there's going to be hurdles. And we also know that the state and local health departments are ready and willing and able to help everybody get over those hurdles. So I think we're all just keeping our fingers crossed.
Well, Adam and Emily, thank you so much for joining us again. We really appreciate the time and all of your great information. If anyone watching this has any questions about COVID-19 and would like to get screened or tested, you can call our COVID-19 hotline at 844-442-5224. We also still have our emotional health relief hotline available 7 days a week from 10 a.m. to 10 p.m. That phone number is 833-442-2211. Thanks, everyone. We'll see you next time.